Hello, I'm Tina. Welcome to my channel, Embracing Aging. Yesterday I touched on holistic health care, and I want to just talk a little bit more about that today because I think that in the West particularly, we're brought up to go to the doctors, to go to our GP if we've got something wrong, like if we've got a chest infection, for instance, we get an antibiotic and hopefully get better. And I don't deny that allopathic medicine's got a part to play. And for myself, I have said before that I suffer from migraines, and without the drug I'm prescribed for migraines, my life would be a whole lot more miserable. So I'm not saying it doesn't have its place. However, I think sometimes there are drugs that we're prescribed kind of routinely that have some really pretty awful side effects. And, if you're having to take another drug to counteract the side effect of a particular drug, then I would question why we're taking it. For example, I've had problems with acid reflux, and I think just looking at this, the generally prescribed proton pump inhibitors for that, and I'm just looking at the side effects of these particular drugs. Some of them are really severe, such as angioedema, which includes swollen face, tongue or pharynx, difficulty in swallowing, hives, difficulties in breathing. Severe hypersensitivity, including anaphylactic shock, severe skin reactions. Common side effects. Some common side effects are headache, dizziness, diarrhea, constipation, stomach pains, feeling or being sick, wind, dry or sore mouth or throat, benign polyps in the stomach, skin rash and itching, changes in liver function test values, and tiredness. And those affect 1 in 10 people who are taking these drugs. So I would, I think really perhaps we ought to be looking at another way to deal with acid reflux. And for me, just by identifying the triggers, the dietary triggers, has been a massive help. Like, for instance, I don't eat after 9 o'clock in the evening, because if I eat after 9 o'clock, I have a sleepless night because I'm battling with reflux. So just simple things like that. Cut out, to a large extent, I've cut out dairy and too much bread, things like that. And I don't have to take those drugs anymore. And so basically, apart from my migraine tablets, which I only take when I've actively got a migraine, I don't take anything else, and I'm pretty healthy. And I think it's certainly worth thinking about other approaches. If you've got something that's not life-threatening, don't go to the doctors. Think of other approaches. Like, think about looking at your diet, looking at your lifestyle. If you go out drinking every night, if you have a glass of wine every night and you wake up with a headache the next morning, stop having the glass of wine. Drink more water. This isn't something that's difficult, or, okay, you might have to make a sacrifice. You might enjoy a glass of wine, but really, would you rather suffer the consequences, or would you rather be healthy? I know what I choose. So yeah, although I do like a drink, I know that it doesn't, I don't like the side effects. I hate having a hangover. And, if you've got a job to go to, if you're working or you've got things to do in the morning, you don't want to wake up with a blooming headache and have to take paracetamol or whatever to get rid of that. So look at your lifestyle. But also, if you need help with like relaxation and things like that, there's so many holistic options available to you. You can try this Reiki, which is wonderful. It's like really relaxing, just really beautiful. I don't know anyone who's had Reiki and hasn't enjoyed it. You can try, if you've got sort of addictions such as smoking or overeating, compulsive behaviours, phobias, things like that that interfere with your life, you can try hypnotherapy. It's really good for fast phobia cures and for stopping smoking, for weight management, things like that. You can look at hypnotherapy. You could look at, there's all sorts of things. There's acupuncture, reflexology. There's EFT, which is tapping. I'm trying to think. There's loads more, and there's loads more that you can look into. And I will have a look and see what else. I must have missed loads from that, like, really short list that I've just given you. But yeah, keep an open mind. If the drugs aren't working, or you're having to take two other drugs to counteract the side effects of the original drug you've been given, just have a look at and have a think about how you could maybe just change your lifestyle a little bit, and not have those side effects and not have to take those drugs. Don't be dependent on those, because you can become dependent on over-the-counter or prescribed drugs just as much as you can, like, illegal drugs or over-the-counter painkillers. Prescription drugs are just as addictive. If you're taking them regularly, your body gets used to them. And so I would just say, yeah, have a look at your lifestyle, and especially manage stress, because stress is a massive factor in ill health. So yeah, have a look at your stress levels, see what you can do to reduce those, and hopefully I will be able to give you some advice or some tips later in the week about managing your stress. So that's what I've got for you today. As always, I look forward to you joining me again tomorrow. And yeah, take care, look after yourselves, and thanks again for your support and for all the likes, all the views, all of the comments. It's just phenomenal, and I'm actually quite overwhelmed with how many people have been watching my channel. So thanks very much for that. I really appreciate your support. Bye for now.